Thank you and good evening. I came to listen and learn, but I've been drafted or even commandeered to speak, perhaps to test how attentive I was as a backbencher over there. I must confess that my task is simple because it's a series of congratulations that I have to offer. Congratulations first to Mrs. Sharada Chandra for not only having put together a very informative, very detailed report which traces not only the history of Ayush in India, but clearly illustrates the potential as well as some of the barriers encountered in integrating Ayush effectively into the health system. Clearly, there is a plea for greater integration, but also a certain amount of anxiety about whether the health system will actually take up the recommendations in real earnest. And I think the next set of congratulations, of course, must go to the group from Medanta who have demonstrated that it is indeed possible to integrate effectively, discarding some of the prejudice that existed in the systems of modern medicine, and then try and effectively utilize some of the strengths of Ayush for betterment of patient care. And it is obviously very clear that Mrs. Chandra's report finds a very receptive audience. When sitting there at the back bench, I could see even the Health Secretary of India, Mr. Keshav Desiraju.
Is he here?
He was there outside the door.
He's gone?
He was there for about almost an hour and then left.
You should have told me. Come on.
Well, I did notice him, but obviously he was, I couldn't signal to you because I was also right there at the back. But no, the fact is that there is a tremendous amount of interest, and the fact that people came to listen and to participate in this meeting is a great tribute not only to your personal popularity, ma'am, but also to the fact that the whole subject is of great interest. And as far as Dr. Naresh Trehan is concerned, I think he was being introduced as one of the 50 most powerful people in India. I would just like to say, as has been often said, that there is nothing more powerful than an idea whose time has come, and he actually has brought that idea forth, and that is what actually adds to his power, the power of the ideas. In terms of what I've been asked to actually remark upon, comment upon, is the potential for Ayush in our health system, and particularly in the area of public health. Public health has, of course, a very broad definition. It extends from health promotion and disease prevention, even to ensuring that the health system is properly architectured to deliver the required health services to all of the citizens in this country, which is universal health coverage. And there we had the opportunity of producing a report on universal health coverage for the Planning Commission about a year and a half ago, a framework which partly finds absorption into the 12th plan. But nevertheless, one of the key recommendations that we made in that high-level expert group constituted by the Planning Commission is an effective and earnest integration of Ayush into the health system at all levels of care, so that universal health coverage becomes a reality by pulling together all the available resources of healthcare providers in this country in a fairly well-designed health system. And I believe this is something that is required not as a measure of desperation, as you said. Sometimes when people can't find MBBS doctors willing to go to primary health centers, or private hospitals for different motives want to employ them as casual labor, that's not the way it should be done. It should be done out of respect and recognition that these have an intrinsic value of their own. And that is where the whole idea of integration comes in, both in terms of alternative medicine and in terms of complementary medicine. Alternative medicine, where each system has a distinctive contribution to make and can potentially offer an alternative to the other. Just as sometimes we look at, even in cardiology, whether medical therapy is better than surgical therapy or surgical therapy is better than medical therapy, not in an antagonistic fashion, but as alternate modes of therapy. But complementary again, in a sense that both can actually combine together in the same patient, offer additional benefits which only one system cannot provide, which is what clearly the pain relief in the post-surgical period clearly demonstrates. But I think even more fundamentally, even from point of view of public health management, there is no reason why Ayush practitioners cannot be adequately trained in public health to become health system managers at the district and sub-district level and ensure greater leadership to the national programs, which are floundering at the moment because of poor performance. So, in a sense, that integration will come in not merely when they are seen as additional healthcare providers grudgingly accommodated in the health system, but they're also seen as respected health system managers who can actually rise even to the director of health services. There's no reason why not. But even going beyond that, I would like to merely say that even in the philosophical construct of medicine or health, it is time that we start reintegrating Ayush and the wisdom of our traditional systems of medicine and their understanding of health even into modern medicine, which has actually become somewhat arrogant and has gone astray in its interpretation of science. In fact, this is almost the exact millennium of the Ibn Sina or Avicenna. And in fact, just about 1,000 years ago, he wrote his famous Canon of Medicine, in which he talked about the balance of humors. And he said, it is the art of medicine which has to conserve health, and it's the art of medicine that has to restore health when it is lost. But essentially speaking of it as a balance, which is essentially the fundamental philosophical construct of Ayurveda as well. Unfortunately, modern medicine grew up on a war metaphor. A war against the bacteria, war against cancer, war against a number of infectious diseases. It is an assault, as Dr. Trehan very eloquently put it, either you poison or excise or pulverize. Therefore, which has its advantages, it has had its benefits. But nevertheless, for example, we have looked at all bacteria as enemies, and now, to our surprise and somewhat to our shame, we recognize that 100 trillion bacteria reside in our gut as co-inhabitants, protecting our health, boosting our immunity, protecting against external pathogens. For the 23,000 genes we have in our body, they have 1 million genes which commingle with our genes and together form a super genome which actually interacts with the rest of the biosphere. So with humility, we recognize that we have to live in harmony with our internal environment and the external environment, something which the wisdom of Ayurveda and Unani have always emphasized. And even as we have traced the tradition of modern medicine to the Greek origins, we have forgotten the contribution, for example, of the Arab physicians, not only Avicenna or Ibn Sina, but also Averroes and Maimonides, the Egyptian physicians who illuminated medical thought in the 12th century. In fact, Ibn Sina's Canon of Medicine was translated into Latin, had a profound influence on Europe, went to China and was translated into Chinese. So it is time that we actually bring forth the traditions of all of our classical systems of medicine, infuse even modern medicine with a certain element of not only pluralism as a matter of tolerance, but also eclecticism in terms of looking at different traditions of philosophical thought and accommodating them, and certainly bringing it much more practically into our practice of medicine and practice of delivery of healthcare, whether it's from the sub-center or the district hospital or the health system management. And I think what you have done today is a remarkable event in which you have actually created a powerful case and also a great coalition carry forward. Congratulations.